Hello, I'm Terri Broussard Williams, and thank you for joining us today for this AFP Spotlight session on healthcare. Today, I'm interviewing Terri Maniate, who is in Canada and is an incredible healthcare leader. Terri, welcome.
Thank you very much, Terry. It's great to be here.
I would love for you just to start off the top by sharing with everyone your incredible institution and just why you have a passion for diversity, equity, and inclusion.
Well, I've been very fortunate to be at the Ottawa Hospital here in Ottawa, Canada, which is the capital of the country. I've been here for about 3.5 years, and I initially started in the role as the Vice President of Education. But as time has come along in the last number of months, I've added a second portfolio, which is diversity and inclusion, in addition to my education portfolio. So it's been very exciting to see our organization, which is the largest academic health science center in Canada. And we serve a very large population in terms of numbers, maybe not so much compared to American terms, but we serve a population of almost 1.5 to 2 million individuals, but the geography spreads pretty wide. So not just the city of Ottawa, but also Eastern Ontario. And we also are very fortunate to be the regional center for Baffin Island. And for those who look on a map, that's that big island that goes all the way towards the North Pole in our Northern Territory, Nunavut. So we have a very large span of influence and responsibility. And in our hospital, we recognize that we have such a diversity of geography, but also the people that work at our institution, but also who come to us in their most difficult times to seek care, and the loved ones that support them. So in all of this, we've been working over the last number of months to realize how do we actually do a better job of supporting all those different groups, the people who work within our hospital. So our staff, our physicians, our learners, our volunteers, and we have about 18,000 to 20,000 of those during the year, but also our patients and their loved ones. How do we do a better job of supporting that? And part of that is just bringing increased visibility to the importance of equity, diversity, inclusion, and accessibility.
Well, you said so much there. I want to break some of those things down, and y'all grab your notebooks and your pens. This is going to be a working session, but there's so many gems that Terri will drop that you're going to want to take notes. And Terri, you mentioned that you serve between 1.5 million to 2 million people a year. And you say that's not a lot of people, but that is larger than some US states like Wyoming, where there's only 500,000 people in the entire state. So it's a whole lot of people. But you also talked about the quality of your intentions and the quality of care. And when you are moving forward in the healthcare space, those two things are so important, and they definitely are guiding stars. And so I want to begin to talk about how you can use compassion and internal coalitions within the hospital setting to really provide change around equity, diversity, inclusion, and you dropped the A, accessibility. We're
Yeah.
going to talk a little bit about all four today. And so I want to start there. And I love that you included the A, because really we have to shift from convenience, of just D, E, and I, or D and I, even for some organizations, to idea. But we have to add the A,
Mhm.
especially in the healthcare setting. Inclusion, diversity, equity, and accessibility are so important, because all of those things are going to make a ripe environment for people to feel that you care while you're providing the care that they need. So just want your reaction as how you were able to make the shift to include that A in your setting.
That's a great question to ask, Terry. And I think part of it is in the DNA of our organization. I think our organization, and one of the things that really attracted me to coming to the Ottawa Hospital 3.5 years ago, was our mission statement, actually our vision statement, sorry. And then the vision statement says to provide each patient with the world-class care, exceptional service, and compassion we would want for our loved ones. And for us as an organization, it has really been burned into all aspects of what we're trying to do. Now, there are areas that we are still working on. This is a work in progress. We're not at perfection, clearly, but there's a desire and an aspiration to push ourselves to putting ourselves in the shoes or in the bed, in some case, of the patients that we're serving, and to say, what would I want from my mom? If this was my mom, what would I want? And how would I hope that she is going to be cared for? And likewise, if you start thinking about that, irrespective of who is in the bed, and we serve such a wide swath of our population, whether it's ranges in ethnicity, race, gender, whether it's socioeconomic, at education level, all of these parameters, if we come at it and say, how would I want them to be cared for? And so the foundational element has to be that there's this compassion towards serving others. And from there, we started to percolate the idea of what would our vision be for a Center for Diversity and Inclusion. And as we did so, we realized that we have to even go further than just having a compassionate heart, and realize that there's a journey that we are actually all collectively going on. And the reality is we may not even realize where we're hoping to eventually end up, but we want to be further than where we are. But in doing so, we're walking together, and we're doing so not with the, I know where I'm going and I'm going to take you with me kind of attitude, but rather, we're in this together. We're all trying to learn. We're trying to unlearn things and relearn things. There are things that I just don't know. And there's a humility that has to be baked into how we do this. This is not, and it's not false humility. It has to be a sincere humility.
Yeah.
That we do so, that we say, we're going to walk together. Let's go for a journey. And we may have some pitfalls, we may have some challenges, but we'll get to it and through it together.
Well, let's put a pin in that, because you said a whole lot, and I want to make sure that, those people that are taking notes can take some notes and connect some of the dots that they might have as we're walking on this journey today. But, you started off by saying, we should take a moment to walk in people's shoes or in the bed. And that's so important, because when you're in a healthcare setting, not just in a hospital, but maybe, a day-to-day doctor's office, or even now telehealth, we're commuting a whole lot by video and phone. You have to walk with people. You have to talk to them, in the medium that you're using. You might have to, think about how they're receiving that information from a video in bed, or even, in a wheelchair. So we definitely have to walk that journey. So again, I want to, at this point, I want to put up a slide with your mission that you mentioned at the top, because that mission of your organization is important. And it's tied to something that I'm calling the continuum of change that you highlighted in a previous conversation that we had. And so we'll now change it to the slide. That's the continuum for change, or what I'm calling it. And these are your actual words. You said that you develop a statement where you talk about walking together in humility and sincerity, and you will create a shared understanding. And that shared understanding is within yourself as the administration and leadership, but those that are enacting every day, the care and the intentions that you have, so that your patients can feel it. And when you have that shared understanding for each other, then you can be on that common journey. And so I love that, because many of the people that are watching today are in healthcare, right? And they are fundraising professionals. And so we have to think of this continuum from, the leadership of the hospital to that development director, or even
Mhm.
someone that is in patient care or touches base with patients when they leave home. If we're not all speaking the same language, then that sincerity cannot be felt from end to end. And
That's
you
right.
want your patients to really know you for not only just that first care service, that first class service, but also for that first rate compassion. And so you develop a model that is based on three things. It's focused on patient care, education, and research. And so I'd love for
Mhm.
you to talk a little bit about that. So as people are beginning to map out their own journey, they know
Mhm.
that those three things should be top of mind.
And it's important to appreciate that within an academic health science center like the Ottawa Hospital, but this parallels almost any sort of university, bigger hospital. But even I've worked in a community hospital in Toronto, and we had the very similar three pillars, the three missional pillars we call them. And this helps us focus our efforts. We take that vision statement that we have in our organization. Every hospital or every organization will have something. It's embedded, or it's sort of supported by these three pillars. And for us, we realize that if we want to proactively and positively impact our organization, we have to address these three areas. The clinical experiences, the patient care experiences, the education, and education is pretty broad. Most people think it's just the students or just the resident physicians who are in your hospital, but we have 5,000 learners from all swaths of health professions and non-health professions. But you think about all those physicians, the nurses, the pharmacists, the frontline environmental services team, the food service, all of these are individuals who are actively learning
Yeah.
in our workplace. So there's a continuing professional development that they need. And we need to make sure that they're part of this journey as well. But then also our research elements. Yes, the Ottawa Hospital, as many other hospitals, they're well known for maybe it's drug development or new tests and investigations or new ways to use medications, which is really amazing kind of stuff. But there's this new lens that we need to think, which is, are we making a difference? Are
Yeah.
we asking the right questions? How is it meaningful to engage a community? What would our community want? What would they look as meaningful engagement? And then how do we measure success? And oftentimes we are very reductionist. We love numbers. We like to say there was a 20% increase, or a 4% decrease in this. But we're talking about stories oftentimes when it comes to diversity, equity, inclusion, and accessibility. We're talking about stories of individuals' lives who have had an experience prior to something and then have a new experience afterwards. We still have to figure out, how do we measure the change over time and ask those kind of questions. So I see this as coming into all of these areas, and you have to include all of those areas to actually move the entire organization forward. Or it's just seen as a clinical thing, or just an
Yeah.
education thing, or just a research thing, as opposed to, this is our entire organization's journey. We're all going on it together. That's our North Star. We're heading that way. Let's all go. And that's for us, this has been really an important thing, is to engage broadly as much as we can.
Yeah. Well, it's a continuum, right? There,
Yeah.
you might start it, but it continues for quite some time, and there should be no end, because the needs
Mhm.
will change. The patients that you serve will change, and it's likely to
Right.
grow and not decrease. But there are a couple of things that I do want to tease out. And so you talk about the outputs, the 20% improvement maybe in patient care,
Mhm.
or the 20% of patients who today might have heart attacks, but they end up leaving healthy because you've educated them while
Yeah.
they're in the hospital. Those are aims and drivers, and we should
Yeah.
talk about that for a little bit. Your aim is going to be your really big goal. The drivers are the things that are tactical
Yeah.
and the strategies that are going to help you move them forward. And so I want to talk about two pillars here.
Sure.
There are two pillars that need to happen when you're really moving this continuum in service of idea, the inclusion, the diversity, the equity, and the accessibility piece. So you're going to have your mission and the needs
Mhm.
of your hospital on one side, and then you're going to have your idea needs on the other. And you're going to want to bring them together so that
Mhm.
continuum can move. But for the fundraisers that are watching today, the greatest thing about them all is that you can tie the things that you need to raise money to both the mission and the idea needs. So let's talk a little bit about patient care. By way of mission, you're going to always try to, fundraise for those unmet needs, and patient
Mhm.
care really is an easy way to tell those stories that you mentioned, Jerry,
Mhm.
and to show funders and donors and prospects that there are faces. There are faces there. So when you pull in the idea piece of the strategy, you can really dig into that pillar. And at each of those levels, you can also tease out those things for donors and prospects and ask them to fund it along the way.
Mhm.
So let's look at education and think about that. The people in the hospital might need training on diversity so that they can be educators that can translate information or be aware of the latest thing that is necessary in a telehealth environment. But you can also fundraise so that those tools are provided in languages that will serve your
That's right.
patients, or that your patients are having education when they return to their homes
Mhm.
in a manner that resonates with them. So there's just so many ways that we can connect the dots by way of diversity,
That's
equity,
right.
inclusion, and accessibility. And so I want us to give everyone a moment here so that they can record their thoughts. And this is a good place to think about, what is your vision for DE&I? How can you change that to idea? What is your organization's vision for DE&I as well? Because sometimes what's in your heart as a leader or a fundraiser might be different from the organization's vision today. So use that gap to propel your need forward and think about the way ahead. And I want to give you some time to think about that so that you will be able to begin to write a plan. And I've been writing notes while Jerry's talking. So look at those notes that you have, but we're going to give you a couple of minutes to begin to craft those ideas. So, welcome back. You all have really thought about what is your personal idea, mission, and what is your organization's vision for idea. And hopefully those two things are becoming more congruent so that you can begin to develop a plan. So now I want to go back to the continuum of change. And I want to tease out 5 things that Jerry has actually brought to life that are again tied to mission and idea. And there are things that speak both to what is in his head and in his heart. And this is actually how they've found success. So, Jerry, I would love for you just to walk us through this model. You have the first engagement and recognition, then education and training, systemic integration, external relationships. That's truly where the internal coalition shifts to an external coalition so that
Mhm.
everyone can bring about the vision and mission to life, and research and scholarship. And again, it's a continuum. So it keeps going, it keeps continuing. So
That's
I'd
right.
love for you to start with the engagement and recognition piece and just tell us more about how you brought the idea of the strategy and the goals and truly drove the tactics home.
That's a great spot to start, actually, Terry, because that's naturally where our project has already started from. And keep in mind, we have what we were calling our 3 Ps in our organization: the people that work within our organization, the people, the staff, the physicians, the volunteers, the learners, but then also the patients that we are serving, their loved ones and care partners, and thirdly, being the population that we serve in our community. And so, keeping those 3 Ps in mind, what we've done is said we want to figure out strategic ways to meaningfully engage and recognize both the people who work in our organization, the patients, and the population. So we've started by creating a hospital-wide diversity and inclusion council. And we've also identified 5 working groups, which actually fit the 5 bubbles that you see on the screen. So within each, there's about 15 or so individuals. So we have about pushing up to about 80 to 90 individuals now who have volunteered and have passionately said, "I'm interested. I'm in. I want to help you. We want to help this organization move ahead." We've also been starting our environmental scan, both internally and externally, to understand what others have been doing, but also what we are already doing in the area of inclusion, diversity, equity, and accessibility. We've also been continuing on with a healthy conversation series, which has been a fascinating journey on a Facebook Live format to just have conversations of things that most people just are uncomfortable talking about, but giving real faces, real voices of people internal to our organization who are willing to talk about anti-racism, or anti-Black racism, or other issues that are coming up in our conversation based on what's happening in our community. So we're also looking at some employee resource groups to start establishing them, to support them so that they feel like there's a sense of community as we move ahead. That's our engagement and sort of recognition element. Education and training, we're looking right from orientation all the way out to leadership training for those on our senior leadership and board. How do we weave the threads of idea right throughout those experiences? Some of it will require maybe a complete revamp and a complete overhaul. Others will require some maybe slight adjustments just to so that we be able to weave those threads meaningfully and authentically. We're also looking at higher additional kind of educational opportunities, open invitation to everyone. And we've been doing some of these internally and some of them in collaboration with other partners as well. Our third section was systemic integration. And what we have been starting to look at in this area is to start identifying what are the policies of our organization, what are the processes and the structures that are in place, and how do we look at weaving, once again, the thread of idea through all of those things. as we revisit and revise and update. If they are brand new, we should be having those concepts built in right up front, so that they are once again creating the environment. Not that you're just there and we have a diverse workforce, but that you also feel included and belong in that space. We want to create that environment as we do so. The fourth pillar was external relationships, and this is where both myself and my chair of our Diversity and Inclusion Council, Alan Ailey, both of us are quite cognizant of the fact that as a hospital of this size, we have an obligation to our community and an opportunity to take on a leadership role to bring people together, right? Not to tell people what to do, but to create the forum in which these conversations can happen. And maybe there are smaller hospitals or smaller healthcare institutions, or maybe there are organizations that are just passionate about idea and how can they work and partner and collaborate with others. So we're trying to bring a regional kind of forum together to have these kind of sensitive conversations, because what happens in the hospital or what happens in our community overflows into both of those sectors. So it's really important. We were also looking, how do we build relationships with underrepresented communities and community partners that will be in those communities, because I would love to see that our hospital actually is representative of our community. Now, you're probably saying, what does that actually mean? Well, even visibly, we have a way to go in terms of the workforce that works at the Ottawa Hospital, but also the learners that are at the Ottawa Hospital. I think we can do a better job, because there are populations, as we know, this is not a Canadian phenomenon. This is not a North American phenomenon, but there are populations that just don't necessarily see themselves within the healthcare system because they haven't been given the opportunities, mentorship opportunities, pipeline opportunities. We need to strategically think, how do we create those situations to bring people forward into the healthcare system, and then find ways to punch through those glass ceilings or concrete ceilings in some situations, so that we can see this great diversity permeating right throughout the organization. And we know this in the business literature, that organizations that are diverse right throughout are actually more resilient and better organizations in terms of not just productivity, but in terms of the environment and the outcomes that they are able to impact on. So we're looking at those kind of pieces. The final one was the research and scholarship. I think for me, I'm a education researcher, and I can't not do something without asking a question, which is, are we making a difference? How are we using this new methodology to make a difference, et cetera? And I think that's what we need to start doing, is we need to shift from just doing work to doing things that are scholarly, with the intention of sharing those so that other people can do this and more, and just take it and expand it out and adapt it to other contexts. So my heart is to share and to not only share, but also share and be open to critique and feedback, so that we can make our experience even better. But maybe someone will take it and just run with it, and off they go, and they're making a massive impact in their local. We would be so happy to just see that happen. But we wanted to embed that right up front. So whether we're doing engagement or education initiatives or systemic integration or building these external relations, we want to ask the questions. Are we making a difference? How are we doing this? Is this thoughtful? Is this a meaningful engagement? But asking the questions and figuring out what are the appropriate metrics that we can then communicate to demonstrate we are pushing ourselves as an organization further up into the aspiration that we want to achieve.
Well, here's what's so cool about that. I mean, you essentially just laid out a plan for everyone that's watching. And so get ready because we're going to give you some more time to craft your plan. But each of these steps within this continuum give you the opportunity to be diverse, to think really big, and to stretch. When you are thinking about engagement and recognition, you can bring in your volunteers to make sure that volunteer corps is diverse. And again, there's some strategies and tactics there that you can use as a fundraiser
Mm,
to really, help fund the unmet needs of the organization. And at every single step, from the education piece to the systemic integration, you can think again of the idea, and how
mm,
can you really grow and embed this work into your day-to-day tactics within your organization. And so I think it's just an easy way to look at the day-to-day operations and to bring it to life in the utmost diverse manner. And so the last one that I want to add here before we give
yeah.
you all some times to work is, when you're doing this, you need a hype chain, some people to text each other and to check in, but you also need people who are going to speak up when you're not in the room, because this work is hard, this work is heavy, and sometimes it's just easier not to do or to think about it. And
Mhm.
so, who are those allies and champions when you are off the clock and not in the building that are going to speak up and remind people that part of your mission is to take others on the journey and to do it in that sincere way, so that again, idea is at the forefront and it's coming to life. So, we want to give you some time to write out your thoughts of how you're going to do each of these 6 steps in the continuum of change. So we'll pause again here to give you about, 3 to 5 minutes to do your work. All right. Hopefully, you're starting to see your idea and your ideas come to life. I want to go back to allies and champions. It's one that we really have to think about because this is going to help people when you're not in the room, when you're not at the hospital, or even when you've moved on to another institutions. You really want to build that pipeline of people who will be there to help you do the work. Jerry, how do you make this part of the plan come to life in your own institution?
It's a great question, and partly it's because this is a fundamentally important element for the sustainability. Right. Oftentimes, we have a couple of passionate leaders who are driving this sort of project forward, but this is a project that is very different than most other initiatives. There's a heavy minority tax that is often paid by these individuals because they are often people who are either Black, Indigenous, persons of color. They're visibly recognized for being different, and they're stepping forward. They're stepping forward into the front line, of fire, and they are often facing a barrage of very emotional, very psychosocial laden kind of elements that impact them both personally and professionally in the academic sort of sphere and their clinical work, whatever. It impacts them, and it's tough to do this. This is not solo work. You can't do this by yourself and sustain whatever is about to happen. So having those allies there, and some of those allies might be internal to your organization, which is awesome. When they are there, you can see them, you can go for coffee, they can buoy you up and get you inspired and encouraged, and they can help you strategize, how to sort of move things along, and they help open up some of those doors, but they're also there to do some of the heavy lifting as well. But some of the allies that I've been very fortunate, don't actually live in Ottawa. The beauty of Zoom and technology is that they are just a quick call away, and they know you. There's been a relationship of trust that's been built up, and you can bounce ideas off, and they can help you sort of weather those storms, those emotional storms, especially so that you can still help your organization forward. So I think it's really important. You have to have those individuals. Sometimes we call them mentors or other things, but I think as we become leaders, it's harder to find mentors who are more senior to us. We need allies. We need people who are peers or near peers that can help us. And for that kind of role, maybe it's a slightly different shift, but the same concept. So have people who know you, who can help you, who can advise you, who can support you.
And champions, right? And those
Yeah.
champions might be your volunteers. They are cultural ambassadors of your hospitals and your healthcare
Yeah.
facilities. So they know you inside and out, and they are going to speak, the goodness in your heart and the quality and the quantity of your care when they walk out those doors and they talk to their neighbors and their friends
That's
and
right.
family. And so you have to rely on them. And,
Yeah.
for so many of the fundraising professionals that are in the room, I don't have to tell you, you already know this because you all walk the walk. Those volunteers oftentimes become your donors. They become your fundraisers, they are helping you move the needle forward. So let's take those cultural ambassadors along on the journey as well. So, we're going to do some work and we are wrapping things up today. So, really know that you're at the home stretch. Really put your best ideas about inclusion, diversity, equity, and accessibility forward. Um, I want you to take some time to think about that big goal, that big aim that you have, which is tied to your why, both your
Mhm.
personal why and your organization's mission. And I want you to write that out. It might be similar to the mission that we had at the top from Jerry, or it might even be that beautiful quote about walking a journey together. But what is that goal and what is your why? And remember to connect your head and your heart because we succeed when both
Mhm.
of those things are working together. Then we're going to put the allies and champions first. You want to think internally who's going to help you do this work? Who's going to hold you accountable? And who's going to speak on behalf of this plan when you're not at the facility or you're not in the room? Or who's part of that succession plan that you need to begin educating them on this plan and helping them learn so that they can move it forward when maybe you've moved on to a new role or a new institution? And you want to write out a communications plan. How
Mhm.
are you going to communicate this to your leadership, to your teams, to your patients, to your volunteers, and the larger community? 5 things you need to think about. Each of those 5 things will help drive this forward and bring it to life. And build in some quarterly business metrics and tactics so that you can hold yourself accountable and actually have meetings, a QBM where you celebrate the things that you do well, but also have a moment for a failure festival where you celebrate the things that maybe you tried but fell flat, or the things that you tried and they didn't work, but you're going to use them to propel the thoughts forward. So definitely think about that QBM. And also, who's the single threaded owner? Who is that one person that's going to be responsible for each of these steps, reporting out what's happening, calling the team together, and hyping you all up along the way? When you don't have that one single threaded owner, then plans tend to fall flat because that one person isn't staying on top of it and is not communicating. Now, that single threaded owner doesn't have to do all the work, but they're going to be the checks and balances piece of this to make sure that the intention remains the same throughout the process. So before we give you time to work, Jerry, I want to give you just a moment to react to this, or maybe even share how you have built this into your continuum of change at the hospital.
I think this is a very appropriate kind of an approach, and we're talking to funding professionals here, and what we're saying is giving the example I provided from the Ottawa Hospital. I've actually had a very similar conversation with our Ottawa Hospital Foundation senior management team, and so that we're speaking all the same language and understanding these concepts, but articulating them is actually a huge step forward so that you can see there's an accountability. And we've started this with, here's our 12-month plan, and right now we've only taken 12 months. We haven't gone out. We have aspirationally where we'd like to end up in about 3 to 5 years. But we said, let's spend a little bit of time detailing our first year, because as we do our first year, we're going to learn a lot. But as we do so, taking the points that you've listed here, Terri, will be important, because it both visibly explains where you're actually going, who's accountable, and all the mechanisms that will allow you to see, are we on track to keep moving in the right direction? What are the milestones or the signposts along the way that we're going to be looking for to determine, are we making an impact in our organization, our community, the patients that we serve, the people that are working with us, things like that. So I think this is very helpful.
And the beauty of laying it out in this manner and having those quarterly business metrics and meetings where you're drilling down on the tactics, you're immediately having data points that you can share with your funders, with your donors and volunteers about how you are moving the needle and you're bringing everything to life. We say we're taking you along on the journey, and it's because people really do want to go along on the journey, and they just don't want you to hold their hands, but they want to know that they are helping to create change. And so this is why we're doing the work, and why breaking it down in this manner will truly help you propel the work that you do.
As you're saying that, Terri, I think it's important to also remember the higher up in your organization this goes, the greater the chance of sustainability.
That's
So in our organization, having a direct connection to our CEO, president, and the chief of staff, and the board by extension, has been critical, because we know, and the literature shows, that if you don't have those direct connections, things tend to fall flat. Things don't get the resources, things don't get the visibility to propel the change, but also people in the organization sort of discount it because it's not really onto the radar of the senior management or the board. So positionally, that's also a very important piece, is that those that you are enabling to be those leads, the allies, the champions, they need to have that ability to say, we are actually affecting change. We are making recommendations at the highest level that will be listened to, that will be heard and acted upon when appropriate.
That's the most beautiful place to stop our conversation today, or just to pause our conversation until we can all be together again in person to have a coffee chat and to talk about how we have one. But I should say, this is only half of the work. The planning gets us halfway there. We actually have to put these things into practice. And as you think about that plan, those 5 steps that we laid out earlier, that are going to be driven by the 3 P's, we have all the things today for you. But as you think about those 5 pieces of the continuum of change, and you add that 6th important one of allies and champions, give each of those a face, because they're going to begin to be the stories that you tell. Give
Mhm.
each of those an owner within the hospital that can, track the QBM, and make sure that the tactics are happening. But again, that single threaded owner is going to bring you all together, because walking together in humility and with sincerity is how you're going to create a shared understanding, not only with each of you, but for each of the patients that you're serving and the people that are cheering you along, like your volunteers or donors. And that is how you're going to create a common journey that meets every standard of a true plan that includes inclusion, diversity, equity, and accessibility. So I hope you have learned so much today. We're going to continue this conversation. Jerry is going to hold a working session where he can really answer the questions about your plan. I want to welcome you to email AFP any questions you might have for me about how you can truly bring these tactics and strategies forward in a real way, from a point of thinking about the people, the population, and the patients, as Jerry mentioned, or the volunteers, or even how they might translate to fundraising strategies. Just because our time today on Spotlight Sessions is ending doesn't mean that we have to stop. We can continue our own journey and learning along the way. So, once again, thank you so much. And most importantly, thank you for continuing to support AFP. We could not make it every day without each of you.